As we grow older, our bodies begin to show signs of wear, and certain medical emergencies become far more common and far more dangerous. Among the most serious of these threats is a stroke. For seniors, strokes are not only more likely to occur, but also more likely to cause lasting damage or even prove fatal. Understanding the warning signs, learning how to respond quickly, and knowing what to do before, during, and after a stroke can make the difference between life and death. A stroke happens when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. This is a medical emergency. Prompt treatment is crucial. Early action can reduce brain damage and other complications. There are three main types of strokes. Ischemic stroke is the most common type and occurs when a blood clot blocks or narrows an artery leading to the brain. Hemorrhagic stroke is caused by a burst or leaking blood vessel in the brain. Transient ischemic attack, often called a mini-stroke, is a temporary period of symptoms similar to those of a stroke. A TIA doesn't cause permanent damage, but is a warning of future strokes. Regardless of the type, a stroke is always a medical emergency. The quicker you act, the better the outcome can be. Seniors are more prone to strokes because of several factors. High blood pressure becomes more common with age and is the leading cause of stroke. Atherosclerosis, or hardening of the arteries, progresses with age and increases stroke risk. Atrial fibrillation, an irregular heartbeat that becomes more common in older adults, can lead to blood clots. Diabetes, high cholesterol, and smoking are other contributing risk factors, all of which are more likely to be present in seniors. Many seniors are less active, and sedentary lifestyles increase stroke risks. Age-related changes in the blood vessels and heart can also make strokes more likely. Because of these factors, seniors not only face a greater risk of stroke, but also have more to lose when it comes to recovery. Time truly is brain. Every second counts when symptoms begin. Why is it so critical to know the warning signs of a stroke? Because the earlier you identify the signs and get help, the more likely it is that brain damage can be minimized. The first few hours are golden. Doctors often say there's a golden window, usually the first 3 to 4.5 hours, in which clot-busting treatments can work effectively. Delays beyond that point may mean permanent brain damage, disability, or death. So the biggest favor seniors can do for themselves is to know the signs and be ready to act. The easiest way to remember the most common signs of a stroke is the acronym FAST-F, means face drooping. One side of the face may droop or feel numb. Ask the person to smile. If the smile is uneven, that's a red flag. A means arm weakness. One arm may feel weak or numb. Ask the person to raise both arms. Does one drift downward? S stands for speech difficulty. Slurred speech or trouble speaking clearly is a major sign. Ask the person to repeat a simple sentence. If it sounds strange or unclear, this could be a stroke. T stands for time to call emergency services. If you see any of these signs, even if they go away, call emergency services immediately. Don't wait. Time is everything. A stroke can cause 2 million brain cells to die each minute it's left untreated. Don't second-guess yourself. If you suspect a stroke, act immediately. While the FAST method covers the most common and visible signs, there are other subtle or less-known symptoms of stroke that every senior and their loved ones should watch for. Sudden numbness or weakness, especially on one side of the body, could involve the leg, face, or arm, and may feel like the limb has fallen asleep but doesn't wake up. Sudden confusion or trouble understanding can appear as difficulty processing speech, inability to comprehend simple questions, or talking but not making sense. Sudden trouble seeing may involve blurred vision in one or both eyes, sudden loss of sight in one eye, double vision, or difficulty focusing. Sudden dizziness or loss of balance may include a feeling of being off balance, trouble walking, coordination issues, or feeling like you're spinning or floating. Sudden severe headache, often described as the worst headache of your life, is often associated with a hemorrhagic stroke and can come on rapidly and feel explosive. Not every stroke presents with dramatic symptoms. Some strokes, especially TIAs or mini-strokes, may be so subtle they go unnoticed, but they are just as dangerous. A momentary loss of vision, temporary confusion or disorientation, brief numbness in the hand or face, or a short episode of imbalance or speech difficulty are all warning signs. Even if symptoms resolve within minutes, these are not harmless. TIAs are warning signs of a bigger stroke coming soon. Up to 1 in 3 people who experience a TIA will have a major stroke within a year. If you or a senior loved one experiences any unusual symptom, especially something sudden and unexplained, it's far better to go to the hospital and be wrong than to stay home and be sorry. Many people make dangerous mistakes because they believe myths about strokes. Let's debunk a few. Some people think strokes only happen to old people. While the risk increases with age, strokes can happen at any age, even in your 30s or 40s. Others believe that if the symptoms go away, you're fine. That could be a TIA, which is a warning of a future stroke. Some think you can sleep it off. Strokes need immediate emergency care. Sleep delays can cost lives. Many believe it's not a stroke if there's no pain. In reality, many strokes are painless, but still deadly. Never rely on guessing. Treat any warning signs seriously and act fast. Many seniors fail to call for help because they fear being a burden, think it's nothing serious, believe it's just old age, or hope it'll go away on its own. This hesitation can be fatal. Loved ones must remind the seniors around them, your life matters, your health matters. Never wait when it comes to symptoms of stroke. Another part of being alert is knowing your personal risk factors. Seniors should talk to their doctors about their stroke risk based on blood pressure history, heart health, cholesterol levels, family history, lifestyle choices like smoking or diet, and use of medications like blood thinners. Knowing your numbers and tracking your health is an important step in catching warning signs early. Before a stroke even happens, preparation can save lives. Know the nearest hospital that treats strokes. Keep emergency contact numbers posted and saved. Wear a medical ID if you have high risk. Educate your family or caregiver. Have a stroke action plan. Preparation removes panic when seconds matter. In Part 2, we will explore how to prevent strokes in seniors, dive into long-term effects, and look at how lifestyle and mental health affect recovery. You'll also learn how family members and caregivers can play a vital role in detection and prevention. Stay alert, stay prepared, because knowing the signs could save a life, maybe your own. Preventing a stroke before it happens is the most powerful step any senior can take. While knowing the signs is critical, avoiding the emergency altogether is even more important. Stroke prevention requires a proactive approach where health choices are not made out of panic, but from awareness. Most strokes are linked to lifestyle-related factors. That means they're often preventable. In fact, the World Health Organization estimates that up to 80% of strokes could be prevented with proper lifestyle management and medical monitoring. For seniors, this isn't just advice, it's survival. The first major prevention strategy is managing blood pressure. High blood pressure is the single most important modifiable risk factor for stroke. It damages arteries over time, making them more prone to clots or ruptures. Seniors should have their blood pressure checked regularly and follow medical advice on medication and dietary changes. Reducing salt intake, staying physically active, and managing stress all contribute to lower blood pressure. The second critical area is cholesterol. High LDL or bad cholesterol contributes to plaque buildup in the arteries, restricting blood flow to the brain. Lowering cholesterol through diet, exercise, and medication can dramatically reduce stroke risk. Seniors should eat more fiber, cut saturated fats, and increase healthy fats like omega-3s from fish and flaxseed. The third risk factor is atrial fibrillation, or AFib, which increases stroke risk fivefold. This irregular heartbeat can cause clots that travel to the brain. Seniors should be screened for AFib and treated appropriately, which may include blood thinners or other heart medications. Diabetes is another major contributor to stroke risk. High blood sugar damages blood vessels and accelerates atherosclerosis. Seniors with diabetes must maintain tight glucose control through diet, activity, and medication. Regular A1C testing is essential. Lifestyle choices also play a massive role in prevention. Smoking significantly increases stroke risk as it accelerates arterial damage and raises blood pressure. Quitting smoking at any age immediately begins to reverse damage. Seniors should seek support groups, counseling, or medication to aid in smoking cessation. Alcohol should be consumed in moderation. Heavy drinking can spike blood pressure and weaken heart function. Seniors who choose to drink should limit intake to 1 drink per day or less. Exercise improves circulation, reduces inflammation, and strengthens the heart. Seniors don't need intense workouts. Even a 30-minute daily walk can reduce stroke risk. Stretching, swimming, and light strength training help maintain balance and cardiovascular health. Diet cannot be overstated. A diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats protects the heart and brain. Seniors should avoid highly processed foods, excess salt, and sugary snacks. The Mediterranean diet is often recommended for stroke prevention. Weight management is also essential. Obesity is linked to hypertension, diabetes, and heart disease, all of which raise stroke risk. Seniors should aim for gradual, sustainable weight loss if overweight, supported by healthy eating and activity. Stress management and mental health are often overlooked in stroke prevention. Chronic stress raises cortisol levels, which increases blood pressure and inflammation. Seniors should engage in relaxation techniques like deep breathing, meditation, or light yoga. Hobbies, social interaction, and spiritual practices also reduce stress. Sleep quality is another key factor. Poor sleep can raise stroke risk by increasing blood pressure and inflammation. Seniors should aim for 7 to 8 hours of restful sleep per night, seek treatment for sleep apnea, and avoid screens before bedtime. Medication adherence is crucial. Many seniors are prescribed drugs for blood pressure, cholesterol, or blood thinning. Missing doses or stopping medication without a doctor's advice can lead to sudden spikes in risk. Setting reminders or using pill organizers can help maintain consistency. Regular health checkups are non-negotiable. Seniors should visit their doctor for routine screenings, including heart rhythm checks, blood tests, eye exams, and cognitive assessments. Early detection of risk factors can lead to early intervention. Understanding family history is another prevention tool. If stroke runs in the family, a senior is more likely to experience one too. This knowledge should encourage even greater vigilance in lifestyle and monitoring. Hydration is also important. Dehydration can thicken the blood and increase clotting. Seniors should drink plenty of water throughout the day, especially in hot weather. Avoiding excessive caffeine and sugary beverages also helps. In addition to prevention, it's important to understand the long-term effects of a stroke. For seniors, recovery is possible, but the path can be challenging. Depending on the severity, a stroke can cause physical disability, speech and language difficulties, memory loss, emotional changes, and difficulty performing daily activities. Rehabilitation is key. Physical therapy helps restore strength and mobility. Occupational therapy teaches daily skills. Speech therapy aids in communication and swallowing. Seniors may also require psychological support to manage depression, anxiety, or frustration. The recovery journey is different for everyone. Some recover fully, others may have lasting impairments. The key to recovery is early rehab, family support, and a positive mindset. Stroke survivors should not be treated as fragile, but as individuals with the capacity to heal, learn, and grow. Caregivers play a vital role in both prevention and recovery. They must be educated on stroke signs, emergency response, medication management, and emotional support. Family members should learn how to recognize stroke symptoms, monitor recovery, and avoid burnout. The environment also matters. Seniors recovering from stroke should have safe, supportive spaces that minimize fall risk and encourage independence. Installing grab bars, using non-slip mats, and removing tripping hazards can protect against further injury. Technology can be a powerful ally. Wearable devices can monitor heart rate, blood pressure, and irregular rhythms. Medical alert systems provide emergency assistance at the press of a button. Stroke survivors may use speech apps or video calls for therapy and communication. Community resources like senior centers, rehabilitation clinics, and support groups offer companionship, structure, and purpose. Loneliness and isolation increase stroke risk and slow recovery. Seniors should stay socially engaged and mentally active. Faith, spirituality, and purpose also influence health. Many seniors find strength in their beliefs, helping them cope with illness and recovery. A sense of meaning improves mental health, reduces stress, and boosts the immune system. Recovery from stroke is not just about restoring what was lost. It's also about adapting to new realities and discovering new possibilities. Seniors who survive strokes often develop deeper resilience, stronger family bonds, and a renewed appreciation for life. Stroke awareness must also extend to emergency planning. All seniors and their families should have a clear stroke action plan. This includes knowing the nearest stroke-certified hospital, keeping medical records accessible, listing all medications, and identifying a medical proxy or power of attorney. Emergency contact information should be visible and shared. Having a go bag with essentials like medications, Idaho, insurance cards, and health documents can save precious time during a crisis. Education is prevention. The more seniors and their families understand about stroke, the better prepared they are to act quickly and recover fully. Awareness campaigns, community workshops, and medical consultations should be part of every senior's yearly routine. It's important to remember that stroke does not have to be the end of independence or purpose. Many seniors go on to live fulfilling lives after stroke, thanks to rehabilitation, family support, and their own willpower. The key is preparation, action, and belief in recovery. In the end, stroke prevention is about honoring the body and treating health as a priority. It's about choosing daily habits that protect the brain and allow seniors to enjoy their golden years with strength and clarity. It's about knowing that time is a precious resource and acting fast when it's threatened. With the right awareness and response, lives can be saved, futures can be preserved, and the fear of stroke can be replaced with empowerment and peace. In the next part, we'll explore survivor stories, breakthrough treatments, how to live with post-stroke disability, and what the future holds for stroke care and recovery. Every stroke survivor carries a unique story of pain, resilience, and courage. In this final part, we explore those human stories, modern treatments that give new hope, and how seniors can live meaningful lives even after a stroke. Recovery is not the end of the journey. It's a new beginning. Let's begin with the power of survivor experiences. Across the world, thousands of seniors have beaten the odds, survived devastating strokes, and reclaimed their lives with dignity. Some have returned to walking after being told they never would. Others have learned to speak again, write again, cook again, and smile again. These stories aren't just inspiring, they are evidence that with determination and support, healing is possible. One elderly woman in her late 70s suffered a major ischemic stroke and lost mobility on her right side. With relentless physical therapy and the support of her children, she now gardens daily, volunteers at her church, and mentors other survivors. Her message is simple: never give up. Stroke recovery often begins in the hospital but continues for months or years afterward. Seniors who show progress in the first few weeks are more likely to regain independence, but even those with slower recovery can still make meaningful strides. Medical science continues to advance. Today, new treatments are extending survival and improving outcomes. One breakthrough is the use of clot-busting drugs like tissue plasminogen activator, or TPA. When given within the first 3 to 4.5 hours of an ischemic stroke, TPA can dissolve clots and restore blood flow, often reducing long-term disability. Mechanical thrombectomy is another game-changing procedure. In this method, doctors use a catheter to physically remove a blood clot from the brain. It must be done within 6 to 24 hours of stroke onset, and it has significantly improved recovery rates in eligible patients. For hemorrhagic strokes, advances in surgical techniques and blood pressure management have saved many lives. Brain imaging tools like MRI and CT scans help doctors assess stroke damage more precisely than ever. Rehabilitation technologies are also evolving. Robotic-assisted therapy, virtual reality rehab, and brain stimulation therapies are helping seniors retrain muscles and regain lost functions. Personalized recovery plans are now tailored to individual needs, with goals set around what matters most to the patient: walking, talking, or simply holding a loved one's hand again. The role of caregivers cannot be overstated. Seniors recovering from stroke often depend on spouses, children, or professional caregivers for emotional and physical support. These caregivers are lifelines, but they also face immense challenges. Burnout, stress, and emotional fatigue are common among family members caring for stroke survivors. That's why caregivers support programs, counseling, and respite services are essential. A support caregiver is better able to provide patient-centered care and encourage recovery. Emotional health is just as important as physical healing. Depression affects up to 60% of stroke survivors, especially seniors. Feelings of frustration, helplessness, and sadness are common. Seniors may struggle with the loss of independence, speech problems, or social isolation. Mental health support should be part of every recovery plan. Psychologists, therapists, and stroke support groups provide tools for emotional resilience. Peer support can be especially powerful. When seniors connect with others who face similar challenges, they gain hope and a sense of belonging. Living with a disability after stroke requires adaptation. Seniors may need mobility aids like canes or walkers, home modifications like grab bars and stair lifts, and communication tools like speech boards or digital apps. The goal isn't just survival, it's thriving within new limitations. Seniors who accept help and focus on what they can do often find joy in small victories. Regaining the ability to button a shirt, feed oneself, or read aloud to grandchildren can be profound milestones. Every regained skill is a step toward freedom. It's also important to address fear of recurrence. Many stroke survivors worry about another stroke. That fear is valid, but it shouldn't lead to paralysis or anxiety. Instead, it should motivate positive change. Seniors who adopt preventive lifestyles after their first stroke significantly lower their risk of a second one. Medication adherence, regular checkups, stress reduction, and healthy habits all provide protection. Encouragingly, seniors who survive a stroke and commit to these changes often live long, full lives. Some even emerge healthier than they were before their stroke because they begin to prioritize health, relationships, and purpose in new ways. Technology continues to play a powerful role. Apps now help track medications, monitor blood pressure, and remind patients to exercise or hydrate. Telehealth allows seniors to consult specialists without traveling. Smart home devices can provide reminders, detect falls, or even alert emergency services. Artificial intelligence is beginning to assist doctors in early stroke detection by analyzing brain scans and flagging subtle changes faster than human eyes. These innovations, combined with community-based programs, are creating a safer environment for stroke survivors. Communities that support stroke survivors thrive. Stroke clubs, rehabilitation centers, senior wellness initiatives, and local hospitals often offer free or low-cost programs to aid in recovery. Education is ongoing, both for survivors and for the public. Knowing how to respond to a stroke in someone else is just as vital as knowing your own risks. Bystanders who recognize symptoms and act fast can save lives. Every senior should ensure that their family and friends understand the FAST method, know the location of important medical documents, and understand what to do in a stroke emergency. Seniors can also become advocates. By sharing their stories, participating in awareness events, or volunteering with stroke organizations, they can bring hope and knowledge to others. This sense of purpose is deeply healing. Many seniors find that helping others rebuild becomes part of their own recovery. Spirituality and faith play powerful roles in recovery for many stroke survivors. Belief systems provide strength in suffering, comfort in fear, and guidance in uncertainty. Seniors who lean into prayer, meditation, scripture, or religious community often report better emotional well-being. Spiritual practices remind seniors that they are not alone, that life still has meaning, and that every day is a gift. Family unity often grows stronger through the storm of stroke. Children may return home to care for aging parents. Siblings may reconnect. Grandchildren may step up to support. These renewed bonds become sources of healing not only for the survivor, but for the entire family. Stroke can become a teacher, a harsh one, but one that brings wisdom. It teaches gratitude. It teaches patience. It forces reflection. Many seniors who've suffered strokes describe a deep sense of perspective. They no longer worry about small things. They cherish time. They speak more softly, listen more closely, and love more deeply. They learn to live intentionally. Stroke, as devastating as it is, also has the power to awaken the soul. In many ways, it strips life to its core, what matters and what doesn't. And from that clarity, strength emerges. Not all strokes end with recovery. Some take lives and some leave permanent scars. But within every survivor is a story worth honoring, a battle worth respecting, and a light that can guide others. As we close this guide, let it be a call to awareness. Every senior must know the warning signs of stroke. Not someday, but today. Recognize the sudden onset of symptoms. Understand that stroke can strike without warning. Never wait to call emergency services. Learn your risk factors and commit to prevention. Monitor your health, move your body, eat wisely, and protect your heart. Talk to your doctor, educate your family, build a plan, and if stroke ever touches your life, face it with knowledge, courage, and faith. Recovery is possible. Hope is real. Life, even after stroke, can be rich with purpose. Let this be the legacy of awareness, a legacy that protects lives, empowers seniors, and brings peace of mind. Let every household with a senior carry this knowledge as armor, because when stroke strikes, it strikes fast. But so can you. So be fast, be prepared, be strong, and live well. Protect yourself and your loved ones. Subscribe now for more life-saving health knowledge.